welcome to my video. Today I'm going to be covering Chapter 27 of CARB's Focus on Nursing Pharmacology, titled General and Local Anesthetics. Anesthetics are drugs that are used to cause complete or partial loss of sensation. And that's it. The classification anesthetics can be subdivided into two categories. The first is general, and the second is local. A drug's respective subdivision is dependent on its site of action. Now that we've covered the two branches of this drug category, let's get a little bit more in depth. First, we'll start with general anesthetic. These drugs are used for surgical procedures where it's safer and more comfortable for the patient to be unconscious. They depress the central nervous system or brain and spinal cord and cause a state of immobility, unconsciousness, analgesia, and amnesia. Before administering general anesthetics to your patient, you want to make sure that you're assessing for these contradictory factors. The first, neurological disease; the second, vascular disease; the third, pulmonary disease, specifically obstructive pulmonary disease; and finally, any metabolic or excretory disease that may inhibit the removal or waste of the anesthetic from the body. A helpful mnemonic that you can use to remember these contradictory factors is no Vikings on Mount Everest. It stands for check your neurological diseases, check for vascular disease, check for obstructive pulmonary disease, check for metabolic disease, and check for excretory disease. Now onto the stages of general anesthesia. The first stage is a loss of pain sensation. The second is coined the excitement stage. The third, surgical anesthesia, and the fourth, medullary paralysis. In the first stage of anesthesia, the patient loses their pain sensation, as I explained. However, they can still communicate and are conscious. In the second stage, the excitement stage, the patient may show signs or symptoms of sympathetic stimulation. In the third stage, coined surgical anesthesia, the patient will experience a relaxation of skeletal muscles, progressive loss of oculomotor functioning, and they are safe for surgery. In the fourth stage of anesthesia, the patient will go into a deep CNS depression where they'll lose respiratory and vasomotor stimuli. This can lead to a very quick death. When we give general anesthesia to our patients, we want our patients to go through the first through third stages, and during the recovery process, they'll go from third to first. We never want our patients in the fourth stage of anesthesia. Local anesthesia is used to rid a specific area of the body from sensation. They're safer than general anesthesia and don't require any special preparation. The recovery period is faster than that of general anesthesia, and it also doesn't cause a loss of consciousness. Local anesthetics inhibit nerve transmission by binding voltage-gated sodium channels in the nerve plasma membrane, thus a loss of sensation. Local anesthetics are useful for treating painful conditions, preventing pain during procedures or operations, and for post-surgery pain. Before administering local anesthetics to your patient, you want to make sure that you assess for the following: allergies pertaining to the agent that you're giving, and if the patient is pregnant. Local anesthetics can only be used on a pregnant patient if the benefit outweighs the harm. Adverse effects that may arise post-local anesthetic administration are skin breakdown or self-injury, CNS effects like headache, restlessness, anxiety, dizziness, or backache, GI effects such as nausea or vomiting, and cardiovascular effects such as arrhythmia and blood pressure changes, etc., which must be monitored because they can be life-threatening.